Way of the NHS Health Secretary Sajid Javid telling us perhaps how it will be spent in a moment. 10 to 8 is the time. Now, John in Croydon, again, we're talking about the political gamble aspect here. Do you think the dice are going to turn up in the Prime Minister's way? Good morning to you.
Good morning. I believe it will, but equally at the same time, we do need to make sure that social care is in place for people. And the fact that we don't have enough money, sadly, is something that we just have to face, and we just have to ensure that the people going forward are looked after during social care. And the NHS has been crumbling for some time.
Isn't that what the Prime Minister was talking about yesterday? Isn't that what he and his colleagues were trying to set out for us?
Well, yeah, that's what he's trying to set out. It's politically, I put that aside. I'm not a Conservative, but it's not about that. I'm thinking about the public. We need to stay healthy, and we need to be looked after. The fact that the Conservatives got all the sums wrong, and I know we've had a COVID situation, which obviously nobody knew of in the first place. We just have to raise money for the country and for the...
So a lot of people are agreeing. John, I must leave it there because I can speak with the Health Secretary. You say that you are not a Conservative. Let's turn to someone who is. He's a Conservative MP and he's also Health Secretary, Sajid Javid. But it leads me neatly into my first question, which is, with headlines such as tax burden rise to its highest in 70 years, tax and spend Tories, can I just check, this is a Conservative government, is it, Secretary of State? Good morning.
Yeah, good morning. And what I will say, Nick, this is... what we announced yesterday is a very Conservative thing to do.
Is it?
So
tax at this level, the highest tax since World War II. Do expand.
Let me explain. So, for example, the package includes a huge amount of support, record support for the NHS. As Conservatives, we believe in the NHS, that it should be their world-class universal health service, free at the point of use, paid out of general taxation for all of us. We can all see the huge pressure because of the global pandemic that's been put on the NHS. We can see the rise in those waiting lists. I'm not willing to tolerate that. If we believe in an NHS that's paid out of general taxation, this is a very Conservative move. Also, as a Conservative, I believe in fiscal responsibility. That means that if we are going to raise taxes, you've got to be able to absolutely 100% justify that, and I think we've done that with healthcare and the adult social care package yesterday. But also, you should try and keep taxes as low as possible and be as fair as possible. And this tax increase yesterday is a very progressive way of raising money, but also it means that even after this change, I think we end up with something like a tax rate versus our GDP of 35.5% in total, and that is still lower than Germany. It's lower than Italy, it's lower than France. So we remain a low-tax country, and that's important to me too.
A lot of my listeners might challenge you, Secretary of State, over it being fair, because as I understand it, those earning more than £50,000 will not pay an additional increase in the national insurance. So a lot of people would say that the burden is unduly on those at lower incomes, 20, and I appreciate 40 is not a lower income, but lower scale. Surely that's not fair, Secretary of State.
It actually is a very progressive way of raising money.
What, not to tax the rich?
Let me just give you an example. No, let me explain. This does tax the rich, and it means that the more you earn, you pay much more. And let me just tell you a bit about that. The highest 14% of earners will pay 50% of this levy, so that the highest 14% pay 50%. And if you are someone that's on the basic rate of tax, you will pay probably around £180 a year more. If you are on the additional rate of tax, you will pay around £3,000 more. And if you're on the higher, so the higher income you have, the more that you will pay, and that's about as progressive as you can get.
Can you say it's about £3 billion a week, I understand, for the NHS currently? How well accounted for is that money? Is there any misspending or profligacy that could be cut out?
There will always be savings and efficiencies you can make, and by just doing things better.
So why don't we address those then?
We do, and even before we had this pandemic, with what's called in the NHS, it's called a long-term plan. The NHS has committed to, and they've been doing actually quite a good job of finding billions of efficiencies each year. My plan is to continue to work closely with the NHS to find those efficiency savings and just find better ways of doing what we would all expect. So, Nick, if I can give some of your listeners an example,
Please.
I've seen some fantastic examples in the NHS already. I went to the General Hospital in Milton Keynes, for example, which has become the first hospital in Europe, actually, to use robots to carry out general surgery. And not only the robots are more efficient, they're seeing more people, but it means that the recovery for the patient is also quicker because robots are just more accurate than humans. So that kind of investment in technology, in the new surgical hubs, in digital, that's what's transforming the NHS, and that program continues, and this money actually will help us take it even further, meaning more people can be seen.
For a lot of the leader writers this morning and the columnists, it's a political gamble, this. Do you think the Prime Minister's called it right, Secretary of State?
Yes, I do. And the Prime Minister's been very open and straightforward about this. And you're probably going to ask me in a moment anyway, so I'll bring it up about the Manifesto promises that we've made. And the Prime Minister rightly was asked yesterday, what about your Manifesto promise to increase national insurance? Have we broken that? Yes, we have. We've been open about that. No one does that lightly. But why have we done that? And let's look at the NHS. When I came into this job a couple of months ago, I was told if we continue with business as usual, that waiting list is heading to 13 million. I'm not going to accept that. The Prime Minister's not going to accept that. We had to do something. It's happening because of this global pandemic. We didn't expect a global pandemic. I don't think anyone did. And we have to react. So what the job of a responsible government is to look at that, take the situation as it is, and to do something about it and be honest with the people. And that's exactly what we've done.
Well, you mentioned the Prime Minister a couple of years ago talking about those promises. Also, a couple of years ago, we were told that if we left the European Union, we'd be saving £350 million a week that go to the NHS. You're far better at sums than I. I've done a couple here. That's tens of billions of pounds we've saved. Where is it? Why do we need this additional funding now we've left the European Union?
Because despite all the extra money that's gone into the NHS even before the pandemic and the money that's continued to go in, because of the impact of the pandemic, it hasn't been enough to meet the challenges.
State, 350 million, and also, of course, noting that you're a former Chancellor of the Exchequer, so you're far better at sums than I. £350 million a week since January of last year is tens of billions of pounds. Why isn't that bailing out the NHS? Or is it another lie from Boris Johnson, just as the lie in his election manifesto? There is no £350 million a week. There are no promises. You cannot believe a word that comes out of a Conservative's lips. Secretary of State.
Not at all.
Well,
so
where's the 300? Tell me where that 20, maybe £30 billion is. I can't seem to find it. You're both Secretary of State for Health and a former Chancellor. Where is it, Mr. Javid?
Allow me to answer that question. As we've left the EU, it happened at the same time as the global pandemic, and that money and much more has gone into the health and care service. So we have seen in the first year of the pandemic, with the government put in an additional more than £40 billion, so much more than the figure that you focused on because of the pandemic. In the first half of this year, just this year alone, we've put in £29 billion more into health and social care. Just on Monday this week, I announced an additional £5.4 billion for the second half of this year. And now we're announcing this package for the long term. So the money has gone in. And where has it gone? The answer to your question, so much of it, as your listeners will know, has gone into dealing with this pandemic. So those vaccines, those 90 million jabs, that's where it's gone. The extra PPE, that's where a lot of it has gone. The testing and tracing service, where we're spending £15 billion this year so people can get tested before they meet their loved ones. If they don't feel well, they can then make sure that they're isolating and not infecting others. That's where it's gone also. So, we're not hiding any of this money. It's going into the health and care service. It's being used, a lot of it rightly, to deal with the pandemic right now. But we need to plan for the long term. And that's what yesterday's announcement was about.
So we're £407 billion already due to COVID. Thank goodness for Brexit, otherwise there'd be an additional £30 billion then, Secretary of State.
Look, I think we are fortunate as a country that we can actually afford to support our NHS, support our care service. Of course, that support comes from hardworking people through their taxes. Even when we borrow the money. Everyone knows that's not sustainable for the long term. I mentioned that because some people in Parliament were saying, why don't you, we understand you need this money for the NHS. We also want more money in adult social care, but why don't you just go and borrow it? That's not the responsible thing to do, certainly not for a Conservative government.
Lastly, as I understand it, Secretary of State, the tax increases come in as of April next year, but the funding is not available as regards social care until October of the year after, Why the 18-month lag?
No, that's not quite right. So the new policy on the cap, the £86,000 lifetime cap, doesn't come in till October 2023. You're right about that. But the funding, the extra funding for adult social care starts straight away as soon as it's.
But why the lag on the other aspects, Secretary? But why the lag on the other aspects, Secretary of State?
The lag, which aspect, Nick?
The £80,000 that you mentioned that kicks in, as I understand, in October 2023.
That's right.
Why can't that come in effect as soon as people start paying the additional tax?
Or because it's just not possible to have such a huge change to the way we do adult social care in this country and implement that so quickly.
Why?
Because for a start, Nick, it requires specific legislation to go through Parliament. We use some of the old legislation.
You've got
but
until
we're also
April,
going to need,
Secretary of State. You've got 7 months to achieve.
You know what?
It.
The history of our government is littered with governments of the past making promises on massive strategic changes in such a short time frame that they know couldn't possibly be met, and they end up failing. I'm not in that game. I want to make sure that we deliver on this promise to change adult social care. So that's why we set a start date for as quick as we can. But the point I just wanted to add to that, if I may, Nick, is that some of the extra funding into adult social care, so for example, hundreds of millions for workforce training, there's 700,000 new training places, more funding for local authorities so they can pay a fairer cost of care, all of that starts right away.
Grateful for your time, as ever. Health Secretary Sajid Javid appearing here on LBC 1 minute after 8. The news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the Health Secretary Sajid Javid says increasing national insurance